Hi, this is Dr. Pepe, and we are going over the National Counseling Examination, Domain 1, Professional Practice and Ethics. And today we're going to be covering subcategory I, which says explain the counseling process, procedures, risks, and benefits. And again, similar to the previous subcategories, this should be done both in a written format as well as in the language of the client. Let's go over the first one, which is counseling process. So, for me, this is where I explain the different phases: the initial phase, the working phase, the ending phase. This is where I explain goal settings. This is where I explain any inventories, any data that's being collected, and the purpose or reasons for that data, as well as any other information that could be collected, and what the purpose of that is. Also, if you're working with minors, you want to explain both to the parents as well as the minor, um, what the counseling process looks like in their language, right? So, if you're working with the early child, doing play therapy, you would want to explain it in their language as well as the parent. And then best practices would say you want to join them. So, for example, having a double-sided mirror, parents can see what is happening, where those skills can be taken to the house as well. Some of the procedures would include where the waiting area is, how to check in, how to notify of cancellation, how to notify of any emergencies, what some of the fees are if canceling. Those are all procedures that should be in the intake, as well as explained in the client's language. Um, some of the risks. So, when working with trauma, or when working with couples, or when working in a family systems, there can be risks because many times things get better before, or things get worse before they get better. And it's important for clients to understand that, change is hard. And with change, there's risks involved. And that's part of the counseling process. Also, who has access to the clinical notes. That's a risk, right? If you're working in an agency, or working in the uh, criminal justice system, who has access to that information, and what type of information is being gathered in clinical notes. I think it's important for the client to understand, what type of information is being gathered, so that they know, and that they feel, whether they can decide what to share and what not to share. And the benefits, I think it's important to explain to them that counseling therapy is a research backed approach. I have had clients where they ask me, how effective is play therapy? How effective is cognitive behavior therapy? And, I tell them, I'll be glad to share with you some meta analysis that explain in a research peer reviewed setting, why some of these or why some of these theoretical interventions are done in this way. Especially with play therapy, it's not just have the kid run around in a room with a lot of different toys. It's using the toys as a tool of their expression because their verbal skills have not been developed like the verbal skills of an adult. So